The femur is the longest and strongest of the bones in the human skeleton because the femur has to support the weight of the body and then transmit that body weight to the tibia that's found in the leg. So it is very similar in shape and structure to the humerus. It is a long bone, just like the humerus. So it has a proximal end that you're seeing right now, and that proximal end forms part of the hip joint. And it also has a distal end, which you're seeing right now, and this distal end helps form part of the knee joint. If we turn our attention back to its proximal end, we see that the proximal end has this large spherical shaped piece of bone here, and that's called the head of the femur. If we turn the head of the femur and look at it from the medial side, we see this little indentation on the medial side, and that indentation is called the fovea capitis. And this is the site of a short ligament that joins the femur to the coxal bone. We also have the neck of the femur, which is here, and that's this narrow ridge of bone that connects the head of the femur here to the rest of the femur itself. Also at the proximal end of the femur, we have the greater and lesser trochanters, which are actually a little bit easier to see from the posterior side. So we'll go ahead and flip it over here. And they're named for their size. So the more lateral of the trochanters and the larger of the two trochanters is this one here, and that's called the greater trochanter. And this smaller one, that's kind of a little bit closer in proximity to the head of the femur, is called the lesser trochanter. The trochanters are the site of attachment for muscles of the thigh as well as muscles of the buttocks. If we turn our attention to the distal end of the femur, looking at it from the front or the anterior part here, it's really kind of hard to see anything except for this kind of smooth surface right here. And this smooth surface is called the patellar surface, and this is where the patella, or the bone of the kneecap, sits. If we turn it around and look at it from the posterior side, what becomes a lot more apparent are these two rounded projections here. We have the medial condyle right here, which I know you can't see in the frame of the video here, but the medial condyle is just underneath the head of the femur. And the lateral condyle, which is not underneath the head of the femur, are the two rounded projections that we're looking at here. And both of these condyles, the medial and the lateral condyle, form the knee joint with the tibia bone. So both of these rounded condyles would sit on the tibia bone and act like a hinge joint. So just above both the lateral and medial condyle here are ridges of bone tissue called the lateral and medial epicondyles. And both of these epicondyles are sites of attachment for various muscles that that make their way down the femur.